Welcome. I'm Dr. Beth Frades. I'm a clinical assistant professor at Harvard Medical School, and I'm a lifestyle medicine specialist. I'm delighted to be here today to talk to you about the 6 pillars of lifestyle medicine and how they have an impact on your life, especially during this COVID pandemic. My disclosures, I'm on the scientific advisory board of Jenny Craig, have been on that for 10 years. I'm also on the medical advisory board of Obvious Solutions, and I have my own private practice in lifestyle medicine and wellness coaching called Wellness Synergy that I've had for over 10 years. So today we are going to introduce to you the 6 pillars of lifestyle medicine. You'll be able to see how they will bolster your immune system. And I'm going to highlight the role of each pillar for you to enjoy a healthy body and a peaceful mind during this pandemic. We'll identify actionable tips for incorporating more exercise, improved nutrition, stress resiliency, sound sleep, and social connection into your daily life, even during this really stressful time. I'm going to start by telling you that I've been passionate about this area of lifestyle medicine for many years. When I was a resident here in the Department of Physical Medicine and Rehabilitation after my internship at Mass General, I looked into exercise. And I did a study with some of my colleagues at Spalding. We were curious and wondered if physicians' exercise habits mattered. Did they matter in their counseling practices? So what we did was we surveyed family physicians across the country and we asked them a few questions. We were looking to see if there was a relationship between the exercise habits of physicians and their practices in counseling on exercise. So we asked, do you exercise? Do you counsel on exercise? Then we asked, do you do strength training? Do you counsel on strength training? Next, do you do aerobic exercise? Do you counsel on aerobic exercise? You may have read this study. It was published in 2000. We did this in 1999. It's been replicated many times over the past 20 years with the same results, showing that, in fact, physicians who exercise counsel on exercise. Moreover, physicians that do aerobic training counsel on aerobic training. Those that do strength training counsel on strength training. And guess what? If a physician doesn't do strength training, they don't counsel on it. If they don't do aerobic training, they don't counsel on it. So hopefully, you're one of those physicians, those internists that are exercising and that are following the guidelines of one of the major pillars of lifestyle medicine, which we'll review today. Physicians report the barriers for exercise counseling are actually inadequate time and lack of knowledge and experience. So I'm going to try and help you with both of those today. Most of us are inspired each day by patients. Many of us have 1 or 2 patients that are stuck in our minds, and they serve as motivation for us day to day. Often these people may be someone that you experienced or knew as a child, adolescent, and actually helped you find your path into internal medicine. Sometimes it's a patient from internship or residency, or even current patients that continue to inspire. I'm going to share a story of an inspirational patient, and he has given me full rights to discuss all aspects of his health and his care. So right here you see a 72-year-old gentleman, but I'm going to bring you back to a time when he was 52 years old, overweight, overstressed, overworked New York City businessman who dined almost exclusively on fast foods, cakes, candies, hot dogs, pretzels, anything that he could find on the New York City streets, the sides of the road. You can find all sorts of processed, unhealthy foods. And those were his go-to. He did have some hard candies in his middle drawer at work, which he enjoyed throughout the day. In terms of his stress management, he would stress eat. Really didn't have a healthy way of coping with stress, and this had a huge impact on his sleep, which he didn't do more than about 4 hours in a night consistently through. He would wake throughout the night thinking about his clients and what he had to do the next day. He would generally go to sleep around 12 and wake up, 1 o'clock, 2 o'clock, and then sleep till 6 and catch that 6:30 train back into the office. He did have family. He had children. He had a wife. His children were teenagers, and he was not fully present when he was with family and friends because his mind was constantly on work. In terms of the other pillars of lifestyle medicine, which you're going to know by heart by the end of this, but substance use is one of them. At this point, he was not smoking or drinking anything at all. Oh, of course, he was drinking water and sodas, and but not any alcoholic beverages, and he never had smoked. One of the major pillars that we already talked about of lifestyle medicine is exercise. I didn't tell you about this gentleman's exercise habits, despite the fact that he was an outstanding athlete, soccer, basketball, baseball, throughout his schooling. At this time in his life, 52, he really didn't do anything. No exercise, sedentary lifestyle. But actually, the fact that he did no exercise isn't entirely accurate. So let me correct that to tell you that he did one thing, and it was sporadic. It happened at the same time of the day when he did it, but who knew what day he would do it? And the time of the day was 11:07 p.m. That's when he would engage in this exercise or physical activity. You're probably wondering, what on earth could that be? Well, I'll tell you, it was sprints. Mad dashes, sprinting from Park Avenue to Grand Central Station so that he could catch the last train home. Because if he didn't catch that train, he'd sleep on the cot, which was rather uncomfortable, in his office. Now, he had done it before. That's what propelled him to go so fast. Each time 11:07 would hit the clock and he would hit the streets. On one of these mad dashes to the train, he experienced a little bit of, pressure. No pain, no gain. He forged forward on to the train. That pressure in his left chest continued, got worse. By the end of the train ride, he felt as if he had an elephant resting on his chest, numbness and tingling down his left hand, diaphoretic, pale, short of breath. His wife, who was a school teacher, looked at him upon arrival to the home station, where she dutifully picked him up as usual. And one look, and she brought him right to the local emergency room, where he completed his massive, myocardial infarction and subsequent right middle cerebral artery infarct, leaving him paralyzed on the left side. And that is the day in the life of this gentleman. Now, I trained in physical medicine rehabilitation, so I've seen this story many times, over and over. Very similar. But this one I know so well. And I know about those candies in the middle drawer at work, because that's my dad. And that happened when I was 18 and he was 52. And I've been on this path of learning how to live a healthy life to avoid these health setbacks, heart attack, stroke, for many years now, looking at exercise, nutrition, stress resiliency, more recently, social connection and sleep and substance use. So I'm happy to share with you the fact that my dad did make a full recovery, except for fine motor movement, of his left hand, which you probably guessed, but otherwise he made a full recovery. And he also made a complete lifestyle change. So looking at the 6 pillars, exercise. He got a stationary bike and he was on that bike for 5 days, 1/2 hour each session, accumulating the guidelines of 150 minutes per week. In terms of nutrition, that fast food diet changed and he adopted the Harvard Healthy Plate, meaning half of the plate is fruits and vegetables, a quarter is a whole grain, and a quarter is a healthy protein. Avoiding red meat, processed meat, trying to get plant protein, some fish twice a week. Then let's go to stress resiliency. I told you his stress resiliency plan was stress eating. So that changed, and he learned about deep breathing. He also learned the power of a power walk and how it could reduce his stress levels. Let's go to the 4th pillar, social connection. I mentioned he had a wife and children. He wasn't fully present. He learned how to be fully present. And I'll never forget the first time my mom was sitting at the kitchen table. He came up from behind, gave her a kiss on the cheek. And I realized the man can have loving relationships and be fully present and really be in a high quality connection, which we'll review today. Next pillar, sleep. 5th pillar. I told you he basically got 4 hours of sleep at most prior to this heart attack and stroke. And afterward, he was reaching the guidelines of 8 hours. He changed his work around, which helped with stress reduction, so that he was in at 10 and out at 3 and able to eat dinner with his family. Lastly, we mentioned substances and what he was drinking. Well, at that time, it was recommended, this is in 85, this happened in 1985, it's recommended that you drink a glass of red wine to reduce your risk of heart attack. And that's what he adopted, 1 glass of red wine a night. Now we'll talk about that when we talk about the 6 pillars and what the current recommendations are. Here are the 6 pillars for you. Hopefully you'll remember these, and they're all important for our well-being, and especially in this stressful time of COVID, especially in this time when we want to bolster our immune system. Each one of these, exercise, nutrition, sleep, stress management, social connection, and substance use modification or elimination, are critical in this time. Let's go through these. You know about exercise from medical school. We do review in great detail how we can enjoy a lower blood pressure, a lower heart rate, reduce our risk for cardiac disease and stroke with exercise. One thing we don't review very often, though, is the fact that it has an impact on our brain, on our hippocampus specifically. You may not have read about this literature, even though it's been around for almost 10 years. I was surprised to find it myself about 8 years ago. I'd never even considered the fact that routine exercise could increase the size of our hippocampus. And as you remember, as internists, the hippocampus is involved in consolidating memories. Many of you are seeing patients with dementia. And if you have had patients with dementia, you understand that it is such a difficult condition. And if you have family members or loved ones with this, you know deeply how important it is that we work to improve our memory, keep our memory, and indeed, if we can increase the size of our hippocampus, all the better. Exercise also helps with our immune system, and this is critical right now. So the guidelines were created in 2008 by the United States Health and Human Services Department. They looked at about 8,693 studies, several studies. Physicians and exercise physiologists and researchers evaluated all this literature, and they came up with the guidelines. They created this graph, which you see on the x-axis, moderate to vigorous leisure time activity in hours per week, and on the y-axis is the relative risk of all-cause mortality. So you can see, I mentioned that the guidelines are to accumulate 150 minutes of moderate intensity physical activity in the week. 150 minutes is 2.5 hours. If you look at the graph, you'll see at 2.5 hours, There is a marked reduction in all-cause morbidity and mortality at that point. And then if you are looking for even more benefits from exercise, the recommendations are to go out to 300 minutes, or that would be 5 hours, and that's when the graph begins to plateau. Moderate intensity physical activity, as you know, means that you can talk while you're exercising, but you cannot sing. If you can sing, you're at low intensity. If you can't talk or sing, you're at vigorous. And if you are engaging in vigorous activity right now, then your recommendations, actually the guidelines are half. So 75 minutes of exercise at a vigorous intensity is recommended. If you want to do more and get more benefits for your body and your brain and your immune system, then you go up to 150 minutes of vigorous intensity exercise. Now, of note, if you just move from, 5 minutes a day, maybe this is, or less than 5 minutes a day, and you move to 10 minutes a day, say 70 minutes in the week, look at that steep curve. Can really decrease the all-cause mortality. So if we can get our patients just moving for 10 minutes, that would really benefit them and our population at large. Now, that's not all we need to do, though. We also need strength training twice a week on non-consecutive days. And that's a part of the program that many people forget. But as we know, and as you well know, as internists, we need our strength, especially in our elder years, because that is when we are at risk for fall. We're carrying our groceries, we slip, we fall, hip fracture, and you know the rest. So we need to increase our musculature, and we do start to lose muscle mass at age 30 if we aren't working on strength training. There's a lot of great data on comparing exercise to medication. And you can see for coronary heart disease, looking at odds ratios, looking at exercise compared to medication, exercise does really well for heart disease. For stroke, it does extremely well compared to medications. Now for heart failure, you want to continue on the diuretics, but exercise is also very good. Pre-diabetes, exercise is helpful. Of course, the medications are critical at times, but that's good to know. Now, we need to be creative in our jobs as internists and practicing medicine. And in this time where stress is high, we want to make sure that we do things that reduce our stress levels. And a 5-minute walk has been shown to reduce our state of anxiety, not trait, but state of anxiety. And moreover, there have been experiments done at Stanford showing that a 20-minute walk can actually increase creative output or divergent thinking by 60%. So if you've got a tough problem right now with a patient, or perhaps in your own life, your personal life, or with colleagues, if you take a walk, a 20-minute walk, you're going to be more creative. Exercise also reduces the urge for sugary snacks and attenuates urges in response to the stress situation and the cue in overweight people. So this will help your patients, ourselves, and you'll see that all these 6 pillars are actually interrelated. So we want to work on one at a time, or you'll see when you start working on exercise, your nutrition might also change. And let's get into nutrition, the second pillar. What diet is best? I am sure that patients are asking you this, and maybe you're asking yourself this. Well, a very good friend and colleague of mine, Dr. David Katz, he was in charge of nutrition and prevention at Yale Medical School up until about a year ago when he ventured off to have his own company. But for years, he's written textbooks and really focused in on nutrition. He compares different diets. He's been doing this routinely, and he's up to do it again soon. This is the latest one from 2014 when he looked at low carb diets, low fat diets, vegetarian, vegan, low glycemic, Mediterranean, mixed balance, and the Paleolithic diet, which is popular. Then now we might call it a keto diet or a lot of different names. But when he reviews these diets, he looks at the compatible elements, because those are the things we want to focus in on. Limited refined starches, limited added sugars, limited processed foods, limit the intake of certain fats, trans fats, emphasize whole plant foods with or without lean meats, fish, poultry, or seafood. So the focus is on this Harvard Healthy Plate that I mentioned my dad adopted, and that is half of the plate is vegetables and fruit, and a quarter is a whole grain, and the last quarter is a healthy protein. And as many plants as you can get, the better. Why is that? Why we focus in on vegetables and fruits? Because there's a lot of data to show that it decreases the risk of heart disease and stroke. So an average reduction in risk of 4% for each additional serving per day of fruit and vegetables in this study, looking at 469,551 participants and evaluating the risk for cardiovascular disease. Another study showed that those in the lowest category of fruit and vegetable intake, say less than 1.5 servings a day, compared to those who averaged 8 or more servings a day, were 30% less likely to have a heart attack or stroke. And then individuals who ate more than 5 servings of fruits and vegetables per day had roughly a 20% lower risk of coronary heart disease and stroke compared with individuals who ate less than 3 servings per day. So we know the medicine is in the phytonutrients of the fruits and vegetables. And of course we do a rainbow in the plate because every color indicates a different phytonutrient. Now, how are healthy eating patterns disrupted? We know this. COVID actually has created a quote unquote quarantine 15, as you know. Stress is up. Stress can increase the desire for hyperpalatable foods. Those are high in fat, sugar, or both. And also high cortisol levels may be partly responsible. Stress increases our cortisol, as we know. So what can we do about stress and stress reduction, our third pillar? What is stress? The engineering term is pressure or tension exerted on a material object, a state, or for psychology, it's a state of mental or emotional strain or tension resulting from adverse or very demanding circumstances, which we're in now in COVID. We don't want to get into distress or strain. We're always going to have some stress, even before COVID, right? We have stress. We have stress throughout our lives, but what we want to do is harness the stress and get into eustress so we can be productive. We don't want stress to overtake. So what are we going to do? First, I'm going to give you a little more information about stress and the brain. Again, focusing on this hippocampus. I didn't know this. I learned this recently, that in fact, we know stress is not good for us and it leads to a lot of different symptoms, signs, conditions. It also can have a negative impact on our brains and our hippocampus in particular. Again, consolidating memories and our risk for dementia. So if we can, instead of falling into stress and getting into a state of chronic stress, if we can learn stress reduction techniques, we'll be able to avoid many conditions and also keep our brain functioning at a high level throughout our years. So what does the data show us for stress reduction techniques that work? Well, getting out into nature and forest bathing. There's now recommendations to be outside for 120 minutes a week. Now, this has been difficult, of course, with COVID, depending where you are. But if you can get into your backyard, and if you can take a walk with mask, that is beneficial for your health in many ways, and especially for stress reduction. Exercise itself, we know, is helpful for stress reduction. Mindfulness practices, mindfulness-based stress reduction by Jon Kabat-Zinn. Meditation is also helpful. Deep breathing itself is useful. And playing with your pet, cat or dog, just petting the cat or dog will release oxytocin, which, as you know, is a feel-good neurotransmitter. Some people call it the bonding hormone or love hormone. And it does make us feel good and reduce stress. So playing with a pet can be useful. Taking your own vacation, actually turning off your email notifications. It's very hard for physicians. Some hospitals are adopting a practice of rewarding physicians who take vacation and don't sign into their email because everybody needs a break. Now, deep breaths. Upon that exhalation, a long exhalation, it's felt that you can turn on your parasympathetic system, the rest and digest, right? On that long exhalation. So you do inhale and then a long exhalation. You'll notice if you do yoga, that there's a lot of emphasis on the exhalation. Now, medical students, their number one form of stress reduction is listening to music. This can be very useful and an easy tool that you can have at your ready, even in between patients, on the car ride home where you'd like to de-stress if you're going into the office, or if you're at home in between patients during this COVID period and you need a break. Turning on some music would be useful. Yoga itself can help with stress reduction. Laughing. It's very hard during this time of COVID to laugh and to find the humor. But there's a lot of medicinal benefits to laughing. And you can look at this review in the American Journal of Lifestyle Medicine if you're interested. Sometimes sharing funny stories with family and friends, or even just spending a little time and reading a funny book, watching a funny movie, maybe a funny sitcom. Expressive writing can be very useful for stress reduction. And there's evidence that chewing gum can reduce stress, and checking emails less frequently. I had a colleague and a mentor talk to me about putting in times for checking email. So 8 a.m., 12 noon, and 5 p.m. And let everyone know those are your 3 times to check and respond to emails. And that way you have some control, at least a sense of control over your email list. Let's get into the next pillar, sleep, nighttime sleep, nap, and a routine. So we need 7 to 9 hours of sleep. National Sleep Foundation, we need that as adults. We all need that. People think they can survive on 4 hours, and I'll tell you, you can survive, but you're changing your physiology. And you're actually increasing your risk for infection, right? Your immune system goes down when you have sleep deprivation. And you could come here to Harvard and be in one of the sleep deprivation studies. You would be in the sleep deprivation category if you had less than 6 hours of sleep. You would, if you had more than 6 hours and you were getting the 7 to 8, 9 hours of sleep, you would be in the healthy sleep category. And you could decide what category would you rather be in. Now, nap, I'm just going to mention a half-hour nap before 3 o'clock can be healthy and won't disrupt your sleep. Nighttime sleep, 7 to 9 hours. And how are you going to get that? We'll discuss it. But why do you need it so badly? Because it is an impact on your reaction time when you are sleep deprived. So there have been studies that look at blood alcohol levels compared to sleep deprivation and reaction time. This was done in Australia. Being awake 18 hours gives you a reaction time similar to someone with a blood alcohol level of 0.05. Being awake 24 hours, reaction time is similar to someone who has a blood alcohol of 0.10. And you remember that 0.08 is considered legally drunk. So for us to be at our best, we need to set ourselves up for good quality sleep. Make your bedroom like a cave. Quiet with earplugs. Use white noise if you need to. There's also new evidence that pink noise, which is a deeper, lower frequency, sort of a raindrop kind of noise, can be useful. Make it cool, 60 to 70 degrees. Why? Because a drop in core temperature is a signal for sleep. So is melatonin being released from your pineal gland. Naturally, that's a signal for sleep. We want the bedroom to be dark. We want to avoid blue wavelength light, and that comes from your computer, your phone, television, because that blocks melatonin. You could get glasses that block out the blue wavelength light. You can get apps for your phone, your computer if you'd like, but you need to make sure that at least 2 hours before bed, you're not being exposed to blue wavelength light if you want that full, restful 7, 8 hours of sleep. Now, we're going to have to talk about caffeine, something that we don't learn about in pharmacology and medical school. I don't know why, because it's actually a drug that we all use, but I never learned about it until after medical school. And I will share some of the most important pieces of information about caffeine. It binds to the same receptor as adenosine. Why do we care about that with sleep? Because adenosine builds up over the course of the day, and it is indeed another signal for sleep, a buildup of adenosine. Now, if you drink coffee or enjoy caffeinated beverages, then the caffeine is actually going to block adenosine from binding to its receptor. And what happens with caffeine? It revs up cell activity. Adrenal gland produces adrenaline. We get excited. energized. That's actually why we use it in the morning. And the morning is a great time to use it. But if you drink coffee at that general lull of 3 p.m., mind you, 4 to 6 hours later, which is the half-life of caffeine, you will have half of it in your system still. So at 9 o'clock, you may still have half that caffeine in your system. So the recommendations are to drink coffee, if you enjoy it, 1 to 2 cups before 10 o'clock, definitely before noontime. And if you're having trouble with sleep, consider decaffeinated beverages. Now, sleep insufficiency is associated with a significant increase in desire for weight gain, promoting food items following sleep loss, the magnitude of which was proportional to the subjective severity of sleep loss across participants. Meaning, when you are sleepy and sleep deprived, you crave sweets and simple carbs. Specifically, volunteers who slept only 4 hours ate 300 extra calories compared to those who got 9 hours of rest. All these pillars are interconnected. Sleep deprivation can affect not just what you're eating, but your mood, your outlook, your productivity, your creativity, sociability, relationships, your general health, obviously, increase in cardiovascular disease, lowers your immunity. We're going to get into relationships, which is the 5th pillar. Now, Maslow's hierarchy of needs, you may be familiar with this. Physiologic needs are our basic need. First need, we need shelter, we need food, we need water, safety, and then we need love and belonging. That's what we need after our shelter, our food, and our water. We need love and a sense of belonging. What does the research show us? When we have a low quality and quantity of social ties in our lives, it's associated with development and progression of cardiovascular disease, recurrent heart attack, atherosclerosis, high blood pressure, cancer, delayed cancer recovery, slower wound healing. We've known about social isolation and its negative impact on the body for many years. This is from 1979, one of the landmark studies looked at number of connections that people had and percentage of death from all causes. This was from Alameda County, looked at men and women. Men are on the left, women are on the right, different age groups, 30 to 49, 50 to 59, 60 to 69. And then the bar graphs reveal the different number of connections. Most connections are in white. The least connections are these striped bars. And as you can see, the least connections with the striped bars are the highest, the tallest in each age group, meaning the percentage that died from all causes were those that had the least connections in every age group, men and women, from 30 to 70. So there's a real emphasis on trying to cultivate high quality connections. And this has been hard during COVID for many people, patients and physicians, because our lives have changed. Our lifestyles have changed. We're not engaging in the same social interactions that we used to. We need to work to incorporate high quality connections in our lives, even when we are physical distancing, not emotional distancing, but physical distancing. We need emotional support. We need connection. We can do that still with our phones, by the way, FaceTime, Skype, Zoom, physical distancing with people. We want to have high quality connections, the expression of more emotion, both positive and negative, and safety felt in doing so. That's a high quality connection, the ability to bounce back after setbacks. High quality connections are relationships that have generativity and openness to new ideas and influence, as well as its ability to deflect behaviors that will shut down generative processes. So with a high quality connection, you're able to say, I'm not feeling up to my normal self. What just happened has had a big impact on me, and I'm feeling scared. I'm feeling anxious. The tone you used just now makes me feel sad, makes me feel unworthy. Whatever you're feeling, You need to be able to express it even if it's negative. Of course, we want to express the positive too, but it can't always be positive and fake. We do want to share the positive. We also want to feel safe sharing some difficult emotions with people. Let's get into substance use. I mentioned it with my father right off the bat. Obviously, with smoking, it's pretty simple. Quit smoking. Now, alcohol use, again, back in the 80s, it was recommended for cardiac disease. And I want to go through what the American Heart Association recommends now, and then we'll talk briefly about other substances. This is our sixth and final pillar. Let's look at alcohol. The recommendations from the American Heart Association are that if you drink, limit it to 1 drink for a man, 2 drinks for a man, 1 drink for a woman. Those are the recommendations. If you're drinking and you're a man, limit it to 2 drinks. If you're a woman, limit it to 1 drink. So what is a drink? That always comes up. So 12 ounces of beer, 5 ounces of wine, 1.5 ounces of distilled spirits. That's what's considered a drink. Then people ask me, does it matter if you have one at 12 or one at 6? This is over a 24-hour period. The 1 drink for the woman and the 2 drinks for the man. It's over a 24-hour period. Okay. The recommendations now from AHA and CDC, do not start drinking if you do not currently drink. So my dad lived a beautiful 27 years after his heart attack and stroke. And if that had happened to him now, he would not have started drinking. The recommendations now are not to start drinking if you don't currently drink. If you do, you limit yourself. Now, if you're scared about cancer, it's no alcohol at all. Now, remember, I'm the messenger. So you can look this up yourself in the various journals, British Journal of Cancer 2015, BMJ 2015. So this guideline of no alcohol for if you're worried about cancer and for cancer prevention has been around for 5 years. So you can investigate that on your own if you like, but I'd like you to know about it. Now we have colleagues, and in this COVID period, people have been consuming more alcohol and engaging in more substances. That's patients and clinicians. So if you're noticing changes in your own behavior or those of your colleagues, it's important to try to help them and get help. So remember loss of control, neglecting other activities, risk-taking, relationship issues, secrecy, changing appearance, family history, tolerance, withdrawal, continued use of a substance despite negative consequences are all symptoms, signs of substance use problems. Remember, alcohol disrupts your sleep. People have been drinking more and they think it's actually helping them fall asleep. And yes, it may, but guess what? It's going to wake you up in the middle of the night. It's going to interrupt your REM sleep. And those that consume alcohol are actually more likely to be consuming more calories and unhealthy ones at that. If you know someone that may have a problem, reach out and get help. There's a couple of websites that you can go to, and your local medical society should also be helpful. Mass Medical Society here, and I'm in Boston here at Harvard, has physician health services that are very effective, and I recommend it. That's our journey today in the pillars of lifestyle medicine, really important during this COVID pandemic and important post-pandemic, important for all of us as clinicians and as patients, because actually we're clinicians, we're physicians, you're internal medicine physicians, but you're also patients. So I hope you've taken some tips away, and hopefully you'll be able to think about these 6 pillars and reach the guidelines in each of them. Thank you for your time.